2009, a study was conducted at Towson University taking a look at hearing screening training. A national survey was sent to people who train hearing screeners. One of the things that this survey indicated was that there are several common mistakes that hearing screeners make. This section of the video covers these common mistakes and some ways to avoid them.
Common mistake number 1, collapsing ear canal. Hearing screeners may miss a phenomenon called collapsing ear canal. Collapsing ear canal can occur in one or both ears, and it happens when a child has unusually narrow or oval-shaped ear canals, and the walls of the ear canal come together from the pressure of the earphone on the ear. You may be able to see the ear canal walls close when you press your finger on the pinna. A student may fail the hearing screening because of this, even though his or her hearing may be fine. If you suspect a child has collapsing ear canals, here are 2 suggestions. Rescreen the child with his or her mouth open, or rescreen with the earphone held just slightly away from the ear. Opening the mouth changes the shape of the ear canal and it may open the ear canal. Moving the earphone away from the ear canal will result in a slightly quieter sound. However, if it is moved just enough to take the pressure off the pinna, it may open the ear canal and result in a different screening result. These 2 suggestions will not always work, but they may reduce the false positive referrals caused by collapsing ear canal. Common mistake number 2, presenting tones in a predictable pattern. A very common problem seen in new hearing screeners is the use of a predictable pattern when presenting tones. Listen to this example. The way to avoid this is to be aware of the problem and to pause a few times during each screening to make sure the pattern is not predictable.
Common mistake number 3, improperly placed earphones.
Over the past 17 years, I've trained a lot of students to do hearing testing. And some of the things that they do the first couple of times that they place earphones are a little crazy, so I'm going to show you those and tell you how to avoid the mistakes. I have seen students place earphones on top of hair, and that's not okay. I'm going to place the hair gently behind the ear before we go ahead and place the earphones. Also, if they're wearing large or bulky earrings, you want to ask them to take them off. I have seen earphones placed too far forward, too far back, too far up, and too far down. You want to make sure that the diaphragm of the earphone is right over the ear canal. Once I saw a student actually get the earlobe folded up underneath the earphone. Okay, don't test that way. But one of the most common mistakes that I see is that the earphones are switched so that instead of the right earphone being placed on the right ear, it's placed over the left. You have to be very, very careful. The red earphone goes over the right ear. I tell my students, recite red, right, whenever you are placing the earphones. You can do it inside your head. And that way you will get the correct earphone placement. If your earphone doesn't happen to be color-coded, okay, if you don't have a red earphone for the right side, just take a little piece of tape and put right on that side and make sure you have the correct placement of the earphones. Now you're ready to go.
Common mistake number 4, providing visual cues.
Children with hearing loss tend to be very good at using visual information to supplement what they are hearing in the classroom. And so if you set up your hearing screening in such a way that the child can see what you're doing, then they can pass a hearing screening even with a hearing loss. So you have to be very careful of mirrors, of windows, and of metal plates. Let me show you an example of what could happen if you don't follow this guideline. I'm going to have Amanda and Laura demonstrate a hearing screening. In this particular case, we're not even going to plug in the audiometer or turn it on. Now, Amanda's going to take the hearing screening, and Laura's going to go ahead and go through the motions of the hearing screening and see what happens. Notice what happened here. Amanda was able to raise her hand every time that Laura pressed the button, even though there are no tones coming from the audiometer, because she can see what she is doing. If this were an actual hearing screening, Laura would then mark pass on the form, even though there were no tones. So you have to be very careful about the way the screening room is set up.
Common mistake number 5, not switching from right to left ear. One common mistake that is made in hearing screening is to accidentally test one ear twice. In some audiometers, switching between ears requires a change of a toggle switch, and in some audiometers, the right buttons control the right side and the left buttons control the left side. If your school system or health department has both, be sure to pay careful attention during the listening check and write a reminder to yourself to switch ears in the middle. Common mistake number 6, not performing listening checks.
It may be tempting when you're rushed or when you're just moving from one screening room to another or from one school to another in the same day to skip the listening check. I would strongly recommend that you not do this. Audiometers are put into the back of cars, they're put into storage facilities, and they are only calibrated once a year. So it is very important to check your equipment every time it's turned on and off, every time it's plugged in and out of the wall. So if you move between rooms, do the listening check again. And it's not a very time-consuming thing to do either. I'm going to ask Sangmitra to go ahead and do a listening check, and I'm going to time her while she does it.
Done.
43 seconds. Start to finish, less than a minute. It's well worth the time.
Common mistake number 7, using a noisy room, and number 8, increasing the intensity of the tone because of a noisy room. If you can't find a quiet room, you can't conduct a hearing screening. Don't waver on this because of pressure from the school system or health department. Consider this. Here are 2 students. Student A, we'll call him Adam, and student B, we'll call him Ben. Adam has normal hearing, which falls within the normal range here. Ben has a mild and educationally significant hearing loss, which falls within the hearing loss range here. The intensity level of the hearing screening is right at the borderline of normal, here. Theoretically, students with normal hearing like Adam will be able to hear all of the tones, and students with hearing loss like Ben will not be able to hear all of the tones. If the background noise is too loud, it can mask or cover the sounds for both students, and they would both be referred for further testing. This means the screening result for Adam is a false positive. A high false positive rate drives up the cost of the screening program. It also causes children to miss school and family to miss work, and it increases health care costs. It can also make your screening program look ineffective, so audiologists and physicians who receive your many referrals for children with normal hearing will question the accuracy of your program. Imagine a second scenario in the same room with loud background noise. In this case, the hearing screener decides to raise the level of the tone so it can be heard above the noise by the normal hearing student. However, now the tone is above the hearing level for both students and they both pass. This means the screening result for Ben is a false negative. A high false negative rate can cause long-term harm to the development of children with hearing loss who could benefit from early intervention. This may also result in significant damage to the long-term earning potential of the individual, which affects them, their family, and society as a whole. So in summary, do not conduct a hearing screening in a loud room and never turn up the screening level to compensate for a loud room.
Common mistake number 9, increasing the intensity level of the tone to try and find the child's actual hearing threshold.
A number of the respondents to our national survey of hearing screening trainers indicated that one of the problems they see is that hearing screeners increase the level of the tone in order to find out how bad the hearing loss is. This is never okay. In order to determine if a hearing loss exists, a child has to go for a diagnostic audiological test by a licensed audiologist. The audiologist will also make appropriate medical or rehabilitation referrals or provide appropriate treatment. So it's never okay to raise the intensity level of the tone during the hearing screening. Simply mark pass or refer on the screening form.
Common mistake number 10, not wanting to fail or refer the child.
It's a natural thing. Everybody wants all children and adults to have normal hearing, but the fact is some people are going to have hearing loss, and that's what we're here for. Do not change your behaviors when you are testing. Don't go ahead and present the tone a little longer or multiple times. Yes, re-instruct the child if you think they heard you, but if on the second time around you're not getting responses, stop and refer them. They will then go on to have the complete audiological assessment that they need. You're not doing anyone a service if you falsely pass a child.
Common mistake number 11, not cleaning the earphones.
One of the common mistakes reported by hearing screening supervisors is that hearing screeners do not clean the earphones. Here is a picture of one of the many nasty organisms that can grow on earphone cushions and be transferred between children, so be sure to clean the earphones between each child.
Common mistake number 12, not feeling confident as a screener.
It's perfectly natural to feel unsure about your skills when you're doing your hearing screenings for the first time. The best advice I can give you is to watch the video. Watch the video carefully and practice the skills that you saw in the video on an adult. An adult is much easier to test, and then you can try the testing again on a teenager, and then once you test a teenager, try a young child. You'll feel much more confident with your testing skills.
Common mistake number 13, not realizing equipment has failed in the middle of a test. Sometimes screening equipment fails in the middle of a hearing screening, even though the listening check was normal. Things to watch for include an unusual pattern of responses, such as if several children in a row fail at one frequency or all the tones in one ear. Recheck the equipment if you notice this type of pattern. If the lights blink on and off, check the power cord. It may have come away from the wall or the audiometer, or the connection may be loose. If a child reports unusual sounds such as cracking when they move, do a repeat listening check and move the cords while playing a continuous tone to see if the sound reoccurs. If the equipment is faulty and you don't have a backup, discard the screening results for the children affected by the malfunction and reschedule the screening.
Common mistake number 14, passing a child who only missed one response. In order to pass, a child must respond to all tones in both ears. There are no exceptions to this rule. Common mistake number 15, wanting to counsel the child or parents about the screening results.
Don't do it. A screening does not give anyone a right or responsibility to diagnose a hearing loss. That is to be done after the complete audiological evaluation is done. You have just provided a great service by screening a child. If you find there is reason to refer, do so and go on to the next child.
Common mistake number 16, assuming the child hears the tone but is just not raising his or her hand.
It's something you've got to be aware of. It happens to all of us. We have that gut feeling that the child really heard. Something gave you a clue. Well, if they didn't respond in the way you've asked them to, it's a referral. You can re-instruct, and once they don't respond the way you expected them to pass, you have to put it down as a referral/failure and move on to the next child. You wouldn't be doing him any service by prolonging the tone presentation, cranking the volume up. Just don't do that. Accept it. Some people do have a hearing loss.
Common mistake number 17, talking in the screening room. If other adults or children are in the screening room, make sure they know it is not okay to talk during hearing screening, even at a whisper. Common mistake number 18, screening children with hearing aids or previously documented hearing loss. Don't place headphones on top of hearing aids, cochlear implants, or other listening devices. Students who have a known hearing loss do not need to have a hearing screening because a hearing loss has already been diagnosed and treated.